Being non-directive is kind of exactly what it sounds like, really. The skill, if you want to call it that, of not pushing them in any particular direction, about offering them a space where they can explore on their own terms and not bringing in your own agenda, your own solutions, your own advice, and so on. This is easier said than done sometimes, and I think goes back to the importance of self-awareness. Sometimes you might feel tempted to jump in there and give a solution. Maybe you feel you've been through something similar to what they've been through, and you can tell them exactly what you did and they should do that, and so on. You can feel sometimes quite strongly that, yeah, you want to jump in and give advice, and the self-awareness is about spotting that and putting that to one side. Because ultimately, the client knows themselves better than anyone else knows them. They know what hurts. They know what feelings they're having and what meanings they're taking from their experience. Our job is to sit with that and give them a space to figure that out on a deeper level. Ultimately, I give you a space to figure out the pieces in the jigsaw. I don't complete it for you, though. I want to help you, figure out what the remaining pieces are, what the picture looks like, so you can ultimately finish it yourself, so you can find your own solutions. Another thing I often explain to people is around the dangers of giving advice. The dangers if things go wrong, and also if they go right. Firstly, like if I give advice to someone and it just makes everything worse or doesn't really do anything whatsoever, then they're going to come to me and quite understandably perhaps be quite annoyed at the fact that I gave them advice that's just not helped or even made everything worse. On the other hand, if I give advice that's amazing and really helps them in a lot of ways, ultimately there's a risk there of them seeing me as the answer man. In that situation, they still don't trust their own experience. They're not getting any closer to trusting the experience and figuring things out on their own terms and learning that they can do that, which ultimately is the aim of the person-centered approach, to give somebody a greater trust in themselves in that way. Giving advice that is helpful, at least on the surface, there might be occasions where that is justified. I mean, I guess it's for people to figure that out for themselves if they can justify doing that. But ultimately, it feeds into a dynamic which I think ultimately serves to disempower people by seeing the answer existing within other people rather than something that they can work out for themselves. The whole point of the approach is to help a person work things out for themselves on their own terms and come to trust their own experience to a greater degree. There is one example of me potentially giving advice that I would have felt justified. It never actually happened in the end, but I used to work as a debt advisor while I was training to be a therapist, work for a debt charity. And it occurred to me that I might get a client who is in a lot of debt and who might not know what their rights are in relation to that debt. So, for example, with bailiffs or enforcement officers, people who come around to your house threatening to take your stuff away, there's a lot of specific rights a person has in navigating that kind of thing, and a lot of people don't know that they have those rights. So if I had a client, and I thought about this because it was a potential scenario that could have come up, if I had a client talking about enforcement officers coming around to the house, trying to get in, to take stuff away, to pay debts off, I would have been inclined to give them information about that, or at least point them in the direction where they could find that out. Personally, I think that would have been justified. In that situation, on the one hand, there's the, I suppose, relatively abstract purpose of person-centered, of helping a person figure out their own answers and ultimately come to trust their own experience to a greater degree. But then on the other hand, there's the very, I guess, time-limited and concrete issue of them potentially losing their possessions and then potentially losing their house. In that kind of scenario, you've got to weigh them up and decide ultimately what is in the best interest of the client. I could keep strictly person-centered and not give them any information, but then they might lose the house. So what good is that? What good is that ultimately? So yeah, I think it's worth zooming out sometimes and weighing these things up, but I don't think you should ever give out advice without weighing things up and reflecting on it. If I help a person not lose their house or not lose their belongings, then I would have felt that entirely justified. So yeah, there may be occasions when you do feel it appropriate to step outside of that, but I would really think hard about what those situations are. I personally see less of a problem about giving information on rights and on services that are out there that can support a client in other ways other than counselling. I see less of a problem with that, to be honest. Giving specific advice on what they should do is quite a different thing, and I'd be very, very cautious of ever doing that. Next up, I want to talk about a common anxiety that I think a lot of students have, and which I had when I first started, about being directive inadvertently by paraphrasing, by using your own language. You know, if a client, for example, seems annoyed and you bring that in and you say, oh, you sound quite annoyed, or you sound quite angry, or whatever, and people can end up worrying, thinking, oh, what if irritated was the word they would have used? What if another therapist would have used irritated and I used annoyed? And that means in a gentle kind of way, we're framing the experience slightly differently to how the client has looked at it, or even how another therapist might have looked at it. So in a subtle kind of way, all person-centered therapists are kind of being a little bit directive, because they're bringing in their own stuff, their own words. The way I am with them is going to be slightly different to how someone else is with them. And I don't personally see a problem with this. I've tried to get my head around this in the past. I recorded a counselling session where I was a therapist and I had someone role play being a client. And it was spontaneous. I didn't know what they were going to say. But I would often reflect on feelings that were coming up. And it was a good session, I think. But we watched it back with students, and students would pick up on other feelings that they would have honed in on. Feelings that I didn't hone in on, they picked up on different ones, and people said, oh, I'd have talked about that. I'd have asked him about that. So the emotions, the feelings, the meanings that I picked up on and reflected back were one of many options, many things that I could have picked up on. My radar was going off at certain things. I was reflecting those back, and we went off in a certain direction. Other people's radars, students who were watching the video, they were picking up on other things. And if they'd been the therapist in the room, the session may well have gone in a different direction. It might have gone in a similar direction. I mean, we can't replay the universe to find out how the different sessions would be different. But it's a very interesting question, and it I think kind of puts to bed the idea that we can be 0% directive. I think we are idiosyncratic. It's not a formulaic approach. It's about the idiosyncratic process that I have when I'm with the person in front of me, and it's about the uniqueness of the relationship, I suppose. You know, if a client comes to me and I offer them a space, I offer them person-centered therapy, that's likely to be slightly different to how it would go with a different person-centered therapist, equally competent, equally experienced, and all the rest of it. What this goes back to for me is the importance of relationship and the importance of being yourself, being congruent with all your idiosyncrasies, with all your humanness. Bring all that in the room and trust the process of what you're offering the client and whatever direction you end up going in. There's no cookie cutter formula for how to do this stuff. Beyond a certain point of knowing the theory and knowing the skills, there is ultimately trusting in yourself and trusting in offering the core conditions and trusting in the process. And that's perhaps the most important thing to take away from this after you're familiar with the theory, after you're familiar with the skills. That trust and that ability to lean into it is really vital.